Have you ever wondered what happens to those government pilot projects that seem to come and go? We decided to take a look at a pilot project that launched here 2 years ago to improve access to primary care. The plan was to have pharmacists manage and prescribe for chronic conditions like diabetes and asthma and test people for strep A to take pressure off family doctors and emergency departments.
And we're confident that this pilot will support the conclusion that more pharmacies should be offering these services.
That's not what happened. In early 2025, New Brunswick's new Liberal government decided to terminate the pilot rather than extend it.
You know, we participate in many pilots, some work, some don't.
We obtained more than 900 pages of documents that tell the story of how the program began and how problems were apparent from the very beginning. It all started with a lobbyist from Shoppers Drug Mart who pitched Premier Blaine Higgs's chief of staff on implementing a program at this Fredericton Shoppers like one they offer in Alberta.
He became quite excited by that, and it just so happened the Premier was in his office. So I went in and spoke briefly there.
One key difference is that in Alberta, pharmacists can order blood work themselves. When Martin suggested a medical directive to make the same thing happen here, the health department said it wasn't appropriate.
If you don't have that authority with pharmacists, then they still have to go back to their doctor, right? So you're not really solving as much as you could.
It certainly was a barrier to care.
The documents show repeated attempts by Anne-Marie Picone and the College of Pharmacists to change the province's mind, in vain. Instead, patients who came here and needed blood work had to then make a second stop.
So whether that's e-visit, whether that's an after-hours clinic, whether that was the emergency room, whether it was a physician that perhaps they just weren't able to get into, whatever that case might be, then we were having to send them there, and then we have that duplication, because if we were able to do it, it would have just come directly back to us.
The department said making that change to the rules would be complicated and risky and would take time. Doctors resisted the change, concerned that it would lead to another kind of duplication in the other direction.
If a pharmacist is asking for a test, which already was asked by the family physician or the nurse practitioner, the patient is getting the same test done twice in an already overloaded system, that's a big concern.
Many patients were sent to NB HealthLink, a program that itself was designed to take strain off the primary care system. But after a spike in strep cases led to a surge of people seeking tests, NB HealthLink stopped taking referrals from pharmacists in 2 parts of the province. In early 2025, the Liberals decided not to renew the program, saying they would focus on matching pharmacists with doctors in their new collaborative care clinics.
When you see a pharmacist, this is great. But when the pharmacist works together with a nurse practitioner and a physician, they get the whole spectrum of care. And that's what we are working towards, collaborative care.
The health minister won't rule out eventually giving pharmacists that lab test authority, potentially as part of one of those collaborative care teams.
It's not a shut door. We will continue to discuss this with the pharmacists as a very big group, a valuable part of our team. And so it's not over yet.
The documents show that patients using the program had high levels of satisfaction, but there were no reductions to ER visits and no conclusive findings on better health outcomes for those patients. Pharmacists see a missed opportunity to try something new and improve access to primary care.